One of the big reasons that people have developed back problems, particularly in their middle age, is that we're a desk society now. We sit at desks, and our muscles in our core get weak from just sitting and not using them in a three-dimensional way, the way they were meant to be used. But also the hip flexor muscle, which is in the front of the hip, can become quite tight. And that hip flexor connects onto your lower back in a very intimate way. It actually connects on the disc in your lower back and on some of the vertebrae in your lower back. And if that muscle gets shortened up, it causes a lot of tension and compression in the lumbar spine, and also can give you problems in your hip joint. And you end up compensating and doing all kinds of things because of this tightness that's developed in the front of your body, actually. So what we look at very closely is how the hip flexor functions and the elastic qualities that are available in the front of the body to allow the body to move in a three-dimensional way. That's not to say that the back of the body is not important and that that doesn't need to be looked at. We do look at that as well, but from our experience, the part that's really overlooked is the front of the body. And by freeing the adhesions that affect the abdominals, that affect the hip flexor, even some of the lower back muscles, you actually allow those muscles to be able to contract much freer and much quicker. So you get a much better stabilization effect when your muscles can function efficiently and pain-free. We're able to allow you to stand up straighter. You can get up quicker out of your chair without feeling this pulling and tension in your back and your hip. But most critically, the pain in your back will oftentimes resolve, and you'll feel much more flexible in your body because of the freedom that you have by loosening the tissue around the core.